taxed a lot of people to help with the response. We have closed our walk-in clinics for infectious diseases, but we are still seeing high-risk exposures, and we're handling those case by case because we don't want anything to fall through the cracks on those. And then for the staff working our hotline, most of those are the medical staff that we have taken from those divisions. We have also closed our walk-in and our appointment vaccination clinics, but we're really grateful that SuperShot has stepped up to handle that caseload like they had in the past when we had a similar event. We worked with them several weeks ago in Antis Services, and they moved all of their clinic locations to their 1515 Hobson Road site. They're staffed to accommodate this change in the uptick, and they're encouraging people to call for their appointment so they can minimize their folks inside their waiting rooms. But they do have a plan for social distancing, and they have a number of rooms in that facility to accommodate a lot of people. They can accept Medicaid and most commercial insurance just like us, and they don't turn anybody away. So I think what's important to remember for that is this is just not the time to skip the step of childhood or probably most especially newborn vaccination. Last thing we need is some sort of a whooping cough out be prevented through immunization, so we don't want people to skip that as well. So remember to vaccinate the young ones. And once again, a huge thank you to Connie Heflin and her staff at SuperShot for taking this workload as we've directed most of our staff to the pandemic response. And then finally, our medical hotlines is still staffed 8 a.m. to 4:30 p.m. Monday through Friday at 260-449-4499. And if anyone has questions on COVID-19, they're pretty well versed in knowing who can help you if they cannot. So that's a bit of an update on our services. Thank you, Dr. McMahan.
All right, well, I want to talk a little bit about the clinical presentation that folks have. I know you've heard a lot in the news about fever and cough, but I kind of want to go into a little bit more detail about what that actually looked like. According to our most recent data, and this is national data, fever, and that's defined as a temperature over 100.4 degrees, was present in 99% of the folks. Now, remember the caveat is there are people who take certain medications for rheumatoid arthritis and other types of things that may not be able to manifest a fever, so remember to keep that in mind. Also, older folks, it's harder for them to generate a fever, so again, remember that may not be a presenting sign in older adults. Fatigue, I'm not talking about just being tired. I mean, profound fatigue was present in 70% of the cases. Dry cough, about 60%. Muscle aches and pains, about 35%. Shortness of breath in about a third of the folks. And only about a quarter of the people are actually coughing up anything like phlegm or sputum. So dry cough is a predominant symptom that we're seeing. Also, a fair number of people are now presenting with diarrhea, so important to remember that. And then we've been hearing that it's really affecting taste and smell. So that's also something, not sure how long that will last. That's a very uncomfortable symptom, but these are the ways that people are presenting. But I really want to remind you that older folks, again, can sometimes present with a more unusual presentation. Maybe they're confused. Maybe you notice that they're falling. Something like that should make you, number one, consider that there's something going on, or if their blood sugars are suddenly out of control, or they're in congestive heart failure and when they've been well controlled before. These are all things I want adult children to remember about their parents, and those are things that should trigger a call to the physician. A little bit about the clinical course. So what we know is this is a much more protracted illness. Usually with the flu, it's something, boy, when you get it, you know it, and you're down and out for 5 days, and the recovery can take even weeks longer, but it's usually something that's very short. This has been much more protracted. People may start with the fatigue and a fever, and then within 3 to 4 days, that's when they start developing maybe some chest pain when they cough, so shortness of breath, those kinds of things. So that can occur later on in the illness, and it can take up to a week or more before they actually get to the point where they're needing to be in an ICU or those types of things. So this can be a very protracted course. And we've even seen, and this is anecdotally, we've seen people who as you know, the incubation period is 14 days, and we've had people, and it can take quite a while for them to even develop that fever. So again, this is a much more protracted, what we would call an indolent course. Don't be fooled by that. You need to take that very seriously. The overall case fatality rate is still hovering around 2.3%, which makes that very similar to what we saw with the 1918 Spanish flu. Again, that's why you see such drastic measures in terms of trying to slow and minimize transmission. So again, it's because this is a very serious infection with this 2.5% is a really high mortality rate associated with infection. So again, while most of the fatal cases have occurred in patients with advanced age, it's not exclusive to that. And initially, based on what we initially saw in China and South Korea and other countries, this was thought to be predominantly and disproportionately affecting older folks. Evidence from what we're seeing here in the United States is showing that this is really affecting all ages. Data that was published in the CDC in March, 25% of the folks who were affected were 65 to 84 years of age, 18% were 55 to 64, 18% were also 45 to 64, and 29% were 29 to 44 years of age. So I don't want people to think it's just older folks or people with chronic health conditions. It does look like this is affecting people of all ages. And so again, cough and a fever, especially when we know that this is a pandemic virus, by definition, it means it spreads easily person to person. You need to think about COVID. And I think that's really all I have in terms of the clinical course of disease and the spectrum of disease. I'm going to turn over now to Dr. Cameron from our Board of Health to give you an epidemiology update.
Hi there, it's Dr. Cameron. As Dr. McMahan mentioned, I am on the Executive Board of Health, and I'm a neonatologist in practice here in Fort Wayne. One of the things that I wanted to go over today was just sort of where we are in Allen County compared to the rest of the country. And if we go to the first slide, you can see that back on January 21st, we had no cases that were reported in the U.S., but in reality, we know that it was probably circulating in the U.S. for a period of time before that, as we see the cases start to slowly tick up over the first several weeks with 5 cases at the end of January. And by mid-February, we were at 15. And then from there on, we start really seeing an exponential growth in the number of cases on a weekly basis. In the second column, you can see the new cases each day. And over the last week, we've been seeing initially 3,000 cases extra, 3,000, and then up to 16,000 cases, new cases being reported per day. And a lot of that has to do with the increase in the number of tests that are being made available to the public, but a significant portion of these are actually being hospitalized. And you can see that in the number of deaths that are being reported. And these aren't, the third column is the total deaths that we've seen in the US, and obviously that number has gone up today still, where it took from the first diagnosis back at the end of January until the, the beginning of March to see our first deaths that were occurring here in the country. But from there on out, every week that number has grown quite rapidly to where we're seeing, not just 100 cases, 100 fatalities per day, but up over 400 fatalities per day now in total. And the fear is that that number is going to continue to increase as we see the outbreaks that are occurring in places like New York and over on the West Coast with the areas with much higher population density. We can go to the next slide. Here in Indiana, Dr. Swagonski provided a couple of the charts for me, but I just want to show you that this is essentially the same trend that we're seeing here in Indiana, with our first cases being reported a little over a month and a half after the first case in the United States. And it started out very slowly over the course of the first week to 2 weeks of cases being reported here in Indiana. But just in the last several days, we've seen this exponential growth. And that's what we're seeing around the world. And it's something that we have to be aware of, because as we look at what's going on in Allen County, on the next slide, thank you, our first cases were reported just a few weeks ago, mid-March. And over the course of the last 2 weeks, we're seeing an increase in the number of cases. And yes, we're still at the beginning of the curve, where we're still relatively flat when you look at the numbers. But if you look at what we're seeing around the country and around the world, the doubling time for the number of cases in a community has been between 2 and 5 days. And on the aggressive side of that, that 2-day doubling time can put us at well over 250 cases within the next 2 to 3 weeks. Our hope is that that gets stretched out by the social distancing measures that have been put into place. And we know that it takes at least 2 to 3 weeks for these social distancing measures to be seen as hopefully a slow in the number of new cases that are being reported. Next slide. And to that effect, Dr. Swagonski provided this slide as well. We've been talking about reducing that curve, and this explains why. If we look at the number of hospital beds in Indianapolis, and this is comparable to what we would expect to see here in Allen County, if we just have 20% of the population infected, but we can stretch that out, it's only stretched out over 6 months, you already overwhelm the number of hospital beds that are present in the county. And that's going to be the same for Allen County. If we don't slow down the spread from 6 months out to instead over a year or 2 years, then just 20% of the cases can overwhelm the hospital system. If you can see with the numbers, if the infectivity is actually much higher, upwards of 60%, which hopefully we don't see in the course of this year, it will very quickly overwhelm the hospital system, not just the hospital beds, but the ICU beds. If we go to sorry, there's no other slides, but when we look at the morbidity and mortality weekly report that was published last week, it is showing us that, as Dr. McMahan mentioned, the population that's being impacted the most in terms of morbidity and mortality is that oldest population, the 55 and up, and certainly the 65 and up population. With 65 to 75, 28 to 43% of the cases are requiring hospitalization, and 8 to 19% are requiring ICU care. And that ICU care is not just the 1 day to 3 days that we would see with a patient that's recovering, from a surgery. It's a week and a half to 2 weeks where they're in the ICU, and then certainly a portion of those patients are not surviving the hospital stay, with 1.8 to 3.4% overall of the cases unfortunately dying from the COVID-19 infection. So the goal with this is to show you where we are in the community. We've had 1 death reported so far. Each of the hospitals is already seeing an uptick in the number of patients that they're screening for suspected COVID infection. I don't have those numbers, but the hospitals are tracking them daily. Each of the hospitals has designated bed space for these patients. And so hopefully with the measures that were put into place a week and a half ago, we're going to start to see this not continue to increase exponentially, but hopefully start to slow down.
Hi, everyone. My name is Erika. I'm the Director of Community Health and Case Management here at the Allen County Health Department. I'm going to talk to you a little bit about what people should be doing if they're sick. We're getting a lot of calls on our hotline, and so I thought I would address the 3 most common scenarios that we're hearing and give a little bit of guidance on what we should be doing. So the first scenario that we're getting, those are laboratory confirmed cases of COVID-19. Those people are instructed to stay home in isolation until they have been fever-free for 72 hours without any medication, and also at least 7 days has passed since their symptoms started. Members of their family that live in the same house with them are asked to stay home as well. They are placed in what we call a quarantine. So while they are not sick, they're asked to stay home, and they are monitoring for symptoms twice a day until they've completed that 14-day period. The second scenario that we're hearing a lot, and this one is kind of challenging to work through, is people that are being seen by their provider. They're testing negative for flu or RSV or other respiratory pathogens. But because testing capabilities are very limited, they're not being tested for COVID, but they might be told by their physician or might be given a letter from their physician stating that they're presumptive positive for COVID-19, and they don't get any further guidance at that point. So as a community, or at the health department, we've discussed this, and we would like to act as if those cases are true cases and how we respond to them. So while we aren't aware of those cases and they are not counted in our numbers that we report out because they aren't laboratory confirmed, if you do see a doctor and they tell you that you likely have COVID-19, we want you to act as if you do have COVID-19. So you need to isolate at home. You need to stay home until you have been fever-free for 72 hours without medication, and at least 7 days have passed since your symptoms started. We would also ask that your family members that have been exposed to you go into a 14-day quarantine as well at that point. The third scenario that we are hearing is just, people that are sick with respiratory symptoms, but they have not seen a doctor. And so for those people, we would really encourage you to at least call your physician so they can review your symptoms and provide you further guidance. If you do not, we just ask that you stay home until you've been fever-free for 24 hours and just have your family self-monitor. We don't have enough proof to show that you're likely a COVID-19 case at that point. So just act as if you would any other illness when you had a fever, that you would stay home for 24 hours without symptoms. For those people that are in isolation, a couple of helpful tips that we're providing to them so that they can limit exposure to their family members. The most important thing is to stay home. If we ask you to stay home, we need you to stay home unless you need to seek medical care somewhere else. If you need further medical care, we work with you at that point to make sure we make all the necessary arrangements ahead of time. Separate yourself if you are staying in a common home with other people. So if you have a bedroom or a spare room that you can stay in, so you're not having a lot of direct, prolonged contact with your other family members, that's your best option. If you do have to be around your family members, we ask that the patient or the actual person that's ill wears a mask. This could help with the respiratory droplet spread in the home. Make sure you're covering your coughs and sneezes, washing your hands, using a hand sanitizer. Don't share any household items with anybody. Don't share the same cup or eating utensils, toothbrush, anything like that. Clean all high-touch areas. That would include countertops, doorknobs, tables. Obviously, if there's any respiratory secretions on anything, you're going to want to clean those with an approved cleaner according to the instructions. And then the most important thing is to just keep an eye on your symptoms when you're in isolation. As Dr. McMahan said, this can have kind of a slow progression, and you could be a week or two into your illness before you start to take a turn for the worse. So keep monitoring for your symptoms, and certainly let your provider know if you start experiencing anything severe, such as chest pain, shortness of breath, or if your lips start turning blue and you're struggling to breathe. That's all that I had.
Almost done, folks. And again, thank you for your patience. I just want to give you a very brief update on testing. We talked about that extensively yesterday, but it is still very limited and very frustrating for folks who are decision makers in terms of patient care while they're waiting for the results. Not only is access limited, but it's really taking a significant amount of time, days, for these results to get back into the hands of the people who need those test results. So it's hopefully things will break open in the next week or so, but right now it's very frustrating for our local folks who are using that. In terms of resources, we've heard that our local healthcare systems are achieving our goal, which is, again, healthcare must stand. That's our overall goal. They're being quite innovative in how they're addressing the issues of scarcity of PPE and reaching out to some local folks, and I'll let them share that, what they're doing in terms of getting PPE and stuff. But our community is really coming together in some quite innovative ways to address this really important issue. So hats off to them for really doing that. The last thing I want to talk about was the whole issue of the closing of the churches, and this is probably the last comment I want to make about that, and I'm addressing it because we did get some requests for me to speak to what the Attorney General set out to the media, and I just want to highlight a couple things and for you to consider. Really, the purpose of local government, including public health, is to really allow for local officials to respond timely to threats to the health, safety, and overall well-being to their citizens. You know, the decision to order the churches to close is really an example of this type of situation where you need to be able to have the authority to be able to react quickly. Based on local epidemiology and the persistent confusion up until and including Saturday evening, despite really a number of attempts to clarify the need to not meet in groups of 10 or more, After careful consideration and really vetting through our board, I made the decision to implement the existing law, which allows us to limit the church gatherings to 10 or less. We allowed the order to expire the moment the governor's more comprehensive law took effect at midnight last night. So that law has expired. And we, again, did that so that our order could expire to minimize any confusion. So there's just one rule that everybody's following now, and that's Governor Holcomb's rule. A couple things I really want to highlight here. For the Attorney General, local and state and federal legislators who disagree with the current law, this is really their issue to resolve, and I'm sure they can share with you their plan to address this in the next legislative sessions or however they want to deal with this, because this is really in their wheelhouse. We, of course, will continue to abide the law as written in the Indiana Code and use it as a tool to minimize transmission of life-threatening disease. Again, remember, this pandemic is currently on the order of the Spanish flu. That was the last time, as I recall, that this type of order was made. So it's an equivalent situation. And hopefully we have the positive impact that we know that had. I also want to take this opportunity really to publicly thank Governor Holcomb and Dr. Box for their very forward thinking. They're thinking through this. They've developed a plan. They've developed comprehensive and rather distasteful orders to address this 1918 level pandemic, but they've done it. And there will be people in Allen County next year going to work, mowing the yard, walking their daughter down the aisle, all because of these aggressive measures being recommended by our governor and implemented by you, the citizens, that prevented a lot of these people from acquiring COVID-19. And the funny thing is, they'll never know. That's ironic. Finally, I want to use this opportunity to remind everybody that on the other side of every data point we use to make scientifically based public health decisions is a family or an individual going through an incredibly difficult situation. And I'm not going to use their personal information to justify a public health decision vetted by our board, which I made to protect the health and lives of all of our citizens.